Okay, so a big one that probably affects probably 99% of all my back pain clients and myself as well when I went through my injury. Back pain and depression. So this is a tough, touchy, heavy subject to do with back pain. And for those who don't have serious back pain, don't know what it's like. From my experience, I think for me, a lot of it was the fear. So when I did my back injury, and also I've been to see sort of, I think by the time I've been to see the second person, let alone before we even got to the third, and I was literally getting nowhere. In fact, I actually got slightly worse after the first guy. You guys see what we call, these back pain experts. They don't really do proper thorough assessments. First guy didn't even do any x-rays or scans, but anyway. And they're adamant they know what they're doing. And they got these promises, they're going to get you out of trouble, this, that, and the other. Take the money off you. A few little treatments here, there, and everywhere. A couple of weeks in, nothing's getting better. And you sort of say to him, why am I getting better? And the guy was just like, don't know, basically. That kind of gave me the fear that what I'd done to myself was going to be permanent, because the experts I thought I'd gone to see couldn't fix me. Therefore, in my head, I believed it was unfixable. So really the problem is, and I think why a lot of people get stuck into depression, and it can be completely avoided, I think, there's two problems. One is the general training for a lot of people that are called experts in back pain is utterly woeful. And part of that is because they don't approach it in the way that you need to. So for example, I'll give this example to my clients all the time. If someone you knew came up to you and said, hey, I've been diagnosed with cancer, usually your first question is going to be, oh, what type of cancer is it? Is it a skin cancer? Is it bowel cancer? Is it prostate cancer? Is it pancreatic cancer? Is it, cancer in your bones? What is it? When it comes to back pain, we don't tend to think of it like that. We just tend to think of back pain as just this same thing. It's always the same thing for each person. The reality is it's not. So back pain is a collection of problems. And guess what? You can have different cancers that affect your back pain. Not just the bones, but also ones that leave nodules on your spinal cord and things like that, and your nerve endings, things like that. So again, we need to understand what the problem is we're actually dealing with. And then that then gives us a bit of, the more understanding we've got, the better we can pick the right tools to solve the problem, the quicker we'll start to solve the problem. But also, and I hate saying this because it makes me want to vomit in my mouth, but if I get with all my clients, if I get them to understand exactly what their problem is and how they've, in 9 times out of 10, they've just been a victim of an accident, how they've created that problem with their current movement habits, and I can teach them, these are things that aggravate it, and these are the positions and movements that help let it settle down. That does give them a sense of relief, but also a sense of empowerment. I hate saying that word, because it's super cheesy, but it is kind of true. So again, it's one of those classic things like knowledge is power. So, a lot of professionals and experts in the field, they don't know how to thoroughly assess back pain. They don't really know how to get, what we call a precise diagnosis as to what the actual problem is, and that's what you need to not only be successful, but also if you know what you're dealing with, it makes that problem seem a lot more solvable. Because you kind of know the rules of the game going forward, you know what you're dealing with, and if you can't give that person a thorough assessment and tell them exactly what's causing the back pain. So, for example, oh, you're flexion tolerant, great. Why? Is it a muscular problem? Is it an instability problem? Is it because you're an active disc bulge or a herniation? Why? You need to know specifically why that person's getting pain and what causes it and what makes it better. If you can't get those specifics, then you feel kind of like you're just trying to, take pot shots in the dark. You don't really know what's working and what to do to get yourself out of trouble. But also it helps, kind of the second point is you've got to be, this is kind of part of the coaching, I guess, that goes along with rehab, when I do my clients, is teaching people to be super objective about it. So when you're, emotionally subjective about it, you're going to feel like I'm trapped like this forever. I've got no control over it. I don't know what makes my back pain worse, what makes it better. I'm all over the shop. Sometimes I have good days, sometimes I have bad days. When you're objective about it and you understand the problem at hand, you know that, for example, my back feels grouchy today, but that was because, say, for example, I was stuck in a long meeting and sat in a bad chair. I had to do lots of driving. I know the seat in my car isn't the best for my back. And it gives you that, okay, my back's bad, but I'm not worried about it because I understand it. So tomorrow, what I'm going to do is do a lot less sitting, a lot more of my kind of spinal hygiene in terms of positions, but also my basic exercises, and then I'll feel better again. And then straight away you know you've got a toolkit to understand your problem, to also start to alleviate it and solve that problem going forward. So again, my tip is to deal with kind of back pain and depression, which just goes along with being successful with back pain long term, is having that thorough assessment. You need to know what sort of back pain you've got and exactly what causes it and makes it worse, and what are the things that help to settle it down. Because if you don't know those things clearly, having that gap in your knowledge, those blind spots, leaves you open to having bad days or aggravating, not really knowing why, and you get very depressed because you don't know why. So again, if you've got good understanding, that's what gives you that kind of that power and that control over the situation. Once you've got a bit of power and control over the situation, then you know that there's a bit of light at the end of the tunnel. You just have to abide by the rules of the game for your back, and then brick by brick, build yourself back to having a strong, robust back, pain-free back. That's, you can keep out of trouble, but also allow you to do the things that you want to do. And again, that's a big thing that goes along with, for those who've read Professor McGill's book, The Gift of Injury. The gift of injury is that you tackle a problem head on, you take a deep dive into understanding you, your body, your back, and your injury, and you know your problems so well that you get given the gift of being not able to keep yourself out of trouble, but also maximize your performance and tune your body to do the things that you need and want it to do. But you've got to tackle the problem head on, and you've got to be super clear and super consistent with understanding it and applying the rules of the game to your problem. But again, as always, starts with that thorough assessment. I cannot stress the most important, strongest tool that I have as a rehab coach, or anyone has, or you have, in dealing with your own back pain, is getting that initial thorough assessment first of all. Know exactly what your problem is, and then you're going to know which tools you can and can't use to solve that problem, but also you know the path to build yourself back to where you want to be in terms of what you need the back to be able to do. So again, back pain and depression, we've got to get out of being subjective and be a lot more objective about it, but the way to do that is to have enough concise information on your injury. If you can't do that, you're always kind of guessing, you're always going to be open to good days versus bad days, and you're going to be kind of stuck in that rut. Another thing to consider as well is, once you've got that thorough assessment, is being objective about the goals that you set. So most people are kind of just very end goal orientated. I just want to be out of pain. But you're here somewhere and that goal is up here. So what about all the little steps we take to get there? So for example, say someone comes in, I want to be out of pain, and I assess their lateral stability and it's woeful. Then your goal is to get out of pain, you need to focus on the goal of building lateral stability. So as you get better at things like side bridges, suitcase carries, all those sort of exercises, you build the goal of mastering that skill. That's a big step along that path to getting you to being pain-free, so that you get that outcome-based goal that you want. So again, all of it is change yourself, be aware of what your outcomes are, but what are your short-term step-by-step goals, but also the habit goals and the things you need to focus on that are going to build that pain-free back for you. So again, if you can work on mastering your weaknesses and getting strong at them, and mastering your spinal hygiene to not aggravate your back, those are things you focus on, those habit and skill goals, which then lead to your outcome goal of having a pain-free back. So again, it's about changing your mindset. If you always think about just the outcome and you're here and you've got no idea how to get there, yeah, you're going to be depressed and miserable because you don't know what you're doing. So again, you've got to know what the problem is that you're dealing with, and then a good coach will then plan out a roadmap to get you back into things that you want to do. So again, good coaching is going to help prevent a lot of those problems and help stop you from feeling like you're kind of lost and depressed and out of control with it. So again, a little bit of a long video, but I try and do my best to keep these things as short as possible, but they're complicated subjects. But yeah, simple idea is, first of all, as always, understand what you're dealing with first of all with a thorough assessment, and then from there we can plan out the right tools and a roadmap to get you on track. And usually find once you do start making a couple little steps in the right direction, you feel a lot better about it because you know you've got a bit of control of the situation. You know there's a bit of a light at the end of the tunnel.